Hello, this is my chapter 5 of the Social Reform and Progressive Era. I'm Madison Smith, so let's just get started here. First things first, we have some realities in the early stages of an industrial society. So a lot was going on at this time. Social reformers were working towards social reform in a primitive welfare state, meaning that huge social issues could not be tackled without federal government assistance. So change had to be made on a local and non-governmental scale, and this was not something that was very easy to do, which we will discuss in just a minute. Virtually all of the social programs and policies we know today were not in place before 1900, and the political power of corporations dominated by patronage made reform seem impossible. Being that social policies would cost more than local organizations could fund, and Americans were not willing to levy sufficient taxes to fund them, the pioneers of social work profession were met with quite the challenge. And this being that tycoons and large corporations dominated the political and social atmosphere, and the only way to gain adequate funding was to gain the support from the affluent members of society, and because of the rise of industrialization left the priorly affluent people green with envy to climb the socioeconomic ladder higher. Few were keen on funding any social reform programs to help the working class people and immigrants. So next we have some catalysts of social reform. At first, Americans liked the idea of industrialization, representing a new economic frontier. But when the corporate tycoons, who were once a symbol of virtue, hard work, and success, displayed a willingness to fire workers and violently shut down labor strikes following the Depression in 1893, Americans began worrying about the size and power of large corporations and if they could be effectively regulated. In reform periods such as the Progressive Era, attention shifts from moral problems to environmental factors. When the public was shown environmental conditions that were believed to cause social issues, support for reform increased. An environmental focus was critical for reform. As progressives opened up the political process by allowing voters to place initiatives on the ballot, many small reform measures were enacted when legislators showed minimal interest in them. This is just the beginning of how our welfare state developed. And so next we have some early regulatory reforms in the Progressive Era. So, there's motorcycle all the time. Regulations set rules on what companies can and cannot do, and regulations were entirely obsolete in the year 1900. Corporations could sell harmful products, subject workers to hazardous conditions, and much more. Reforming journalists, known as muckrackers, highlighted the social misconduct of the wrongdoers and the innocence of, as I was saying, reforming journalists known as muckrackers highlighted the social misconduct of the wrongdoers and the innocence of the victims in order to rally Americans to support social justice. Once the public was more informed on tycoons and massive corporations and the amount of wealth they were accumulating, they were subjected to proposals to limit their power over labor, downsize their companies, and limit their abilities to bribe politicians, which was extremely helpful for the process of actually getting the wealthy people to not control everything. Problems with this include lack of public health regulations and refrigeration, and that led to food poisoning often. Snake oil cure-alls sold on the street were often scams, and the fear of fire due to the multitude of fire hazards and low safety measures for the many immigrants that were in very, very crammed apartments in Chicago. Luckily, a guy named Homer Folks, who was a muckracker from New York, worked tirelessly to establish audit licensing and monitor programs for public businesses to better working and living conditions. So now we have some of the specter of a social unrest. It is important to note that there were groups such as the Immigration Restriction League dedicated to limiting migration, and one of these methods was implementing literacy tests, a deeply racist policy associated with the doctrine of manifest destiny in the 19th century. In the Progressive Era, 60% of the U.S. workforce was foreign-born, and because of this, there was an enormous pool of relatively passive laborers who were susceptible to victimization and feared retribution if supportive of labor strikes. Progressive leaders were not concerned about the possibility of social unrest. Contradictingly, however, 2/3 of the immigrant workers earned less than $12.50 in a pay period, and research shows $15 was needed to live in Pittsburgh in 1909. The emergence of unconventional but radical and vocal organizations represented a new phenomenon of ethical standards being born. Often with the aid of Catholic Church, synagogues, or fundraising efforts in their communities, immigrants constructed a myriad of self-help and benevolent organizations that helped them face adversity in a new area. So next I have some cultural and policy realities that limited reform. Industrialization required labor-saving machinery, but lacked safety devices, and because of this, 35,000 people were killed and 536,000 people were injured each year during the Progressive Era. That number equals the amount of those injured and killed in the entire Vietnam conflict in the 1960s, which is a lot. And the railroad industry workers were in the most hazardous field of work in the early 1900s. Workers who did file for disability due to workplace injury collected in only 15% disability lawsuits where employers were negligent. Employers at the time had a keenness to avoid placing any preventative safety measures at job sites. Now, private versus public philanthropy. Progressivists did not wish to trade private philanthropy with publicly funded programs, and thus did not support certain publicly funded programs. Settlement houses being a place for immigrants to seek asylum and guidance in America. Hull House, a settlement house that Jane Addams, who was a pioneer in the social work field, established in 1889, served as a focal point for reform. It had a main focus in introducing the middle-class reformers and early social workers to life being poor. Hull House also provided assistance to immigrants and local policy advocacy in her community. By 1910, more than 400 settlement houses had been established. Not to be said to obscure their achievements, but to present the whole story. This did not mean, however, that all settlement houses did as much good as Adams's did. A lot of progressivists were prejudiced against immigrants, worrying about preserving area and eugenics, mixing social unrest from labor strikes, public health with new diseases, and white culture being lost. Next, we have some limited policy reforms for women and children. Something called the Mother's Pension Movement was in place for single mothers, whether widowed, divorced, or deserted, but mostly widowed, that would have to work long hours to support their children. This can be viewed as a first breach in the American orthodoxy that the government shouldn't provide outdoor relief to those in need. And not very many people got this. There was only something, I believe, 47,000 women who actually received this. So it was a limited policy reform for sure. Progressives were able to obtain special courts or juvenile courts so that children did not have to be tried alongside adults. While funding this program was not easy, the National Committee on Child Labor established a National Children's Bureau in 1912. The Children's Bureau was then able to prevent federal contractors from using child labor during World War I. The Supreme Court, while overruling laws limiting the hours of work and wages for men, allowed women similar legislation as in Muller v. Oregon in 1908, seeing as the nation did depend upon their health to produce progeny. So the next slide we have is women seizing opportunity for change. Women in the Progressive era were always especially clever. Women's organizations were numerous. One half of college students in 1920 were women, actually. These educated women then invested in social reform activities. The General Federation of Women's Clubs became a huge national organization with over 1 million members in 1911. Speaking more on the cleverness of women, the formation of the National American Women's Suffrage Association in 1890 argued supporting real progressive reforms by emphasizing a focus on education and protecting the American family to gain the support of affluent males. And more about Jane Addams. She believed immigrants were imbued with a culture of cooperation that would lead the nature in a more altruistic direction, and believed women were born with the cooperative and life-saving ethic that was critical. So next slide, we have some health reforms with a flawed capitalistic model. The start of the Progressive Era is classified with an unstable health in many Americans, as 20% of the populations of entire cities were killed from epidemics. This health scare deriving from a lack of knowledge about healthcare. It was after the 19th century that the education of physicians improved with the establishment of licensed medical schools, which is insane. Notable health reforms took place during this time. Local governments and private charities established public health centers in several American communities, where residents could receive newly developed vaccinations. Health inspectors also enforced regulations requiring a standard of sanitary conditions, as well as upgrading sewer and sanitation conditions, which kept public places much less ridden by disease. The lack of public health regulations and refrigerations led to the snake oils cure-alls, and that, in fact, was actually already mentioned on another slide. I don't know where it is, so just ignore that. Right, so the last slide we have here is the oppression of vulnerable populations, and this is a lot. With the surge of immigrants entering the East Coast in the Progressive Era, around 21 million of the U.S. population of 92 million in 1914 were immigrants who had arrived since 1880. Many Americans did not acclimate to this very well. At the time, social workers and schools encouraged immigrants to adopt the American child-rearing culture. Immigrants did not like this, as one can imagine. Migrating north for more job opportunities, African Americans experienced immense discrimination in job markets, and public schools for African Americans were underfunded, with only 1% attending 4 more years of college. Chinese immigrants came to California by the hundreds in the late 19th century to work in the mines and on the railroads. Japanese followed over the next 2 decades. Americans saw Asians as sinister and worried about the disease brought overseas, journalists referring to this as the Yellow Peril. The Gentlemen's Agreement of 1907 also limited Japanese migration, which was very unfair. And next I have roughly 195,000 Latinos migrated across the border between 1900 and 1920, and despite becoming almost the entire labor force for farming enterprises in the U.S., were subjected to punitive labor, low wages, and denied education and economic opportunities by the landowners who housed them. And that summarizes my chapter. Thank you so much for listening. Okay, goodbye.